The VIDA program is a medical Spanish program that we have here at CUSM. Students see the contents in clinical case, then they see it in clinical skills, and 1 week after they come to the medical Spanish sessions and we review the exact same content that they learned in the clinical skills in Spanish.
For us, this often looks like taking what we learn in our clinical skills component of our curriculum here at CUSM and then transferring it into Spanish, thinking about how to deliver those same commands, requests, suggestions, etc. to patients that is going to be necessary for caring for them.
We flipped the script on how Spanish is being taught. So normally it's very focused on grammar, and it's like you hammer down the grammar of, yo, tú, ustedes, whatever. And it's like that's not really how you learn a language. And that's why I'm so thankful with the VIDA program. We've really restructured it to be clinical based, and we sprinkle in the grammar with it, so then you can start to see what sounds right.
And so this is a long undertaking because this runs in parallel with our systems-based curriculum at CUSM, meaning when we're studying, say, the endocrine system, we're going to start studying how to tell patients about how to manage diabetes and how to do things like that because it's related to that system. And this runs all throughout the year. In this way, we hope that it's integrated with what students are learning in the classroom and in the clinical skills. That way, they aren't learning two completely different things at a time. So that Spanish is sort of auxiliary onto what you're already learning in the classroom.
Here in San Bernardino County, Hispanics form over 53% of the population. So it's a compromise that we have with our future physicians to teach them medical Spanish so that they can serve the Hispanic population in this area.
Of course, all of us on the team and at the school believe that care should be at the level of what the patients can understand and can relate to and connect to. You can't do that without language.
In the VIDA program, we teach not only linguistic content, but also cultural perspectives. So we want to make our patients, our Hispanic patient population, to feel comfortable. And for that, it's essential to learn components of the culture that Hispanic people have in every country or even in every region.
The VIDA program is particularly important to the CUSM community because over at Arrowhead Hospital, our partnership, a majority of the patients do speak Spanish. And I just see the look in a patient's eye when you walk in the room and they realize you speak Spanish, and it just makes such a difference in the patient-physician interaction. So that's why I'm so passionate about making sure that my peers can communicate in their native language.
So that they can connect with their patient, not only linguistically, but also in a cultural way. For example, Hispanic people tend to appreciate more the physical contact, while in other cultures they don't like it that much. So we have to teach what Hispanics prefer, and especially in every region, in every country, so that our future physicians can assist in the best possible way to Hispanic patients.